A recent viewer asked us about the various pros and cons of nasal implants and wanted us to compare that to using cartilage, so we thought that was a good conversation to have here.
Yeah, it's a good question. Nasal implants are something that are more commonly used in patients who are looking for augmentation. They want their bridges higher, they want the tip to be more projected. And there are various types of implants. They're probably more commonly used in East Asia by surgeons there, although there are some surgeons here, many surgeons in North America who prefer implants as well. And this is an example of a type of implant in the nose. This is made of silicone, although there are various materials. We're not huge fans of nasal implants, and Dr. Solieman will show you that we spend a lot of time taking various implants out of patients, and we'll explain why.
Yeah, so these are various types of implants that you see in different sizes and shapes that you'll note. In general, our conversations with patients with respect to this is that the problem is really long-term. Long-term, even when you have thicker skin patients, it tends to be sort of a 10-year result where eventually this starts to push up against the skin and cause problems and have to be removed. More importantly, in our view, it's just aesthetically not appealing. It doesn't really aesthetically make sense to put something like this just across the bridge. Most patients really want some real tip refinement, and this really just goes and sits on top of it and kind of bulks up the whole look. Yes, it does help in building up the bridge, but it really doesn't do a whole lot with respect to tip refinement. It gives a real artificial look.
Yeah, and the reason for that you can see is the implants are a solid block of silicone or some other material. Surgeons like them because they're easy to put in. You create a little pocket, it doesn't take a large amount of time, and you can slide the implant in and it's done. It's a nice smooth contour. The problem is it doesn't really match the natural ups and downs and topography of the nasal anatomy, and for that reason in our minds it can very often just not look very natural. Long-term issues, like Dr. Solieman said, it's a foreign body. So unlike cartilage, it doesn't get incorporated into the tissues the way using cartilage would, and so we've found that many patients are more at risk for the implant moving, getting infected, potentially thinning out or causing pressure on the skin over time, and generally having to come out years later.
So, long story short, we're not big fans of the implants. We think that cartilage can be used to give a much more natural result and give you a whole lot more tip refinement. The cons, I think we've gone over pretty in depth at this point.